4 red flags of potential food allergies in young children. Have you ever wondered if your child's fussiness, rash, or tummy troubles after eating could be more than just a passing issue? Food allergies in young children are more common than many parents realize, affecting their health, growth, and comfort in ways that can be hard to spot at first. These allergies can range from mild skin reactions to life-threatening breathing problems, and catching them early is key to keeping your child safe and thriving. The truth is, your child's body is already sending signals if a food allergy is at play, and knowing what to look for can make all the difference. Some kids eat without issues, growing strong and staying happy, while others show signs of distress that parents might mistake for something else, like a virus or picky eating. What sets these kids apart? It often comes down to a few critical red flags that point to potential food allergies. In this article, we're diving into 4 signs, backed by allergy research, that suggest your child may need testing for food allergies. These aren't just random symptoms, they're patterns observed by pediatricians and allergists who study how food affects young bodies. By the end, you'll know exactly what to watch for in your child, and more importantly, what steps to take to protect their health. Stay with us until the end, because you might be overlooking small clues that could have a huge impact on your child's well-being. Once you recognize these signs, you'll have a clear path to get answers and keep your child safe. Let's get started. Sign 1. Hives or rashes after eating. One of the most visible red flags of a potential food allergy in young children is hives or rashes that appear soon after eating. These skin reactions, red, itchy bumps or patches, often show up within minutes to an hour of consuming a trigger food, like peanuts, eggs, or milk. According to a 2023 report from the American Academy of Pediatrics, hives or rashes are a common sign of an allergic reaction, as the immune system releases histamine in response to a food it mistakenly sees as harmful. A child without allergies eats without skin changes, but hives signal the body is fighting something it doesn't like. Consider 2 toddlers, Emma and Liam, both 2 years old. Emma eats a variety of foods, like yogurt or bread, with no issues. Her skin stays smooth and clear. Her parents never worry about post-meal reactions. Liam, however, gets red, itchy hives on his cheeks and arms after eating peanut butter or eggs. His parents think it's just irritation, but what they don't realize is that Liam's hives are a sign of a possible food allergy, potentially to peanuts or eggs, which are among the top allergens in kids. Hives don't just cause discomfort, they're a warning that your child's immune system is reacting, and ignoring them could lead to worse symptoms later, like swelling or breathing issues. The good news? You can take action if you notice hives or rashes. Start by keeping a food diary, noting what your child eats and when rashes appear, to spot patterns. Avoid suspected trigger foods, like nuts or dairy, until you consult a pediatrician or allergist. They may recommend skin or blood tests to confirm an allergy. If hives are frequent or severe, seek medical help immediately, as they can signal a risk of anaphylaxis, a serious reaction. Ask yourself, does your child's skin stay clear after eating, or do hives and rashes appear? Skin reactions are a red flag. Act quickly to keep your child safe. Sign 2. Vomiting or diarrhea after eating. Another clear sign of a potential food allergy is vomiting or diarrhea that happens soon after eating specific foods. These digestive issues can occur when the body rejects a food it's allergic to, causing the gut to react with nausea, cramps, or loose stools. According to a 2022 study in pediatrics, gastrointestinal symptoms like vomiting or diarrhea are common in young children with food allergies, especially to milk, soy, or wheat. A child without allergies digests food comfortably, but these symptoms suggest the body is struggling with a trigger. Picture 2 preschoolers, Ava and Noah, both 4 years old. Ava eats a variety of meals, like cheese sandwiches or fruit, with no tummy troubles. She stays happy and active after eating. Noah, however, often vomits or has diarrhea after drinking milk or eating ice cream. His parents assume he's just sensitive, but what they don't know is that Noah's symptoms could point to a milk allergy or lactose intolerance, both common in young kids. Vomiting and diarrhea don't just upset your child's day, they can lead to dehydration, poor growth, or nutrient deficiencies if the allergy goes unaddressed. The good news? You can help your child by tracking these symptoms. Use a food diary to record what they eat and when vomiting or diarrhea occurs, noting specific foods like dairy, eggs, or fish. Consult a pediatrician, who may suggest an elimination diet, removing suspected foods for a few weeks, to identify triggers. An allergist can perform tests to confirm a food allergy or rule out other issues, like celiac disease. If symptoms are severe or frequent, seek medical advice promptly to prevent complications. Ask yourself, does your child digest food comfortably, or are vomiting and diarrhea common after meals? Digestive upset is a red flag. Don't ignore it. If you're finding this article helpful, please comment number 2 below to let me know you're here, and consider subscribing for more health insights. Let's keep going. Sign 3. Wheezing or breathing issues after eating. One of the most serious red flags of a potential food allergy is wheezing, coughing, or trouble breathing after eating. These respiratory symptoms can signal a severe allergic reaction, where the airways swell or constrict in response to a trigger food, like shellfish, nuts, or eggs. According to a 2021 study in the Journal of Allergy and Clinical Immunology, respiratory issues are a hallmark of food allergies in kids, especially in severe cases that could lead to anaphylaxis, a life-threatening emergency. A child without allergies breathes easily after meals, but wheezing or shortness of breath is a critical warning. Imagine 2 siblings, Mia and Lucas, both 3 years old. Mia enjoys a range of foods, like shrimp or strawberries, with no breathing problems. She plays happily after meals, with clear lungs and steady breaths. Lucas, however, starts coughing or wheezing after eating shrimp or peanut butter. His parents think it's a cold, but what they don't realize is that Lucas's breathing issues could indicate a severe food allergy, putting him at risk for dangerous reactions. Breathing problems don't just scare you and your child, they're a sign the body is in distress, and immediate action is needed to prevent harm. The good news? You can protect your child by acting fast. If you notice wheezing or breathing issues after eating, stop giving the suspected food and seek emergency medical help, especially if symptoms worsen or include swelling or fainting. Carry an epinephrine autoinjector, like an EpiPen, if your child has a known allergy, and consult an allergist for testing to identify triggers. Keep a food diary to track symptoms and share it with your doctor. Teach your child to tell you if they feel funny after eating. Ask yourself, does your child breathe easily after meals, or are wheezing and coughing common? Breathing issues are a serious red flag. Get help to keep your child safe. Sign 4. Fussiness after feeding, ages 0 to 1 year. In babies aged 0 to 1 year, persistent fussiness, crying, or discomfort after feeding can be a red flag for food sensitivities or allergies, especially to foods like milk, soy, or eggs. Unlike normal fussiness, which might come from hunger or tiredness, allergy-related fussiness is consistent and tied to feeding times, often paired with other symptoms like rashes or spit up. According to a 2020 report from the World Health Organization, food sensitivities in infants can cause distress and affect growth if not addressed, as the immature immune system reacts to certain foods. A baby without allergies feeds calmly, while fussiness after meals suggests a problem. Consider 2 infants, Olivia and Ethan, both 6 months old. Olivia drinks formula or breast milk and settles happily after feeding, sleeping well with no distress. Her parents enjoy her calm demeanor. Ethan, however, cries intensely after every feeding, arching his back and fussing for hours. His parents think it's colic, but what they don't know is that Ethan's fussiness could be linked to a milk or soy allergy, causing discomfort in his tiny body. Fussiness after feeding doesn't just make parenting harder, it can signal an allergy that needs attention to ensure your baby thrives. The good news? You can help your baby feel better. Keep a detailed food diary, noting what you or your baby consumes, including breast milk or formula, and when fussiness occurs. If breastfeeding, consider if your diet includes common allergens like dairy or nuts, as these can pass through milk. Consult a pediatrician, who may suggest switching to a hypoallergenic formula or eliminating foods from your diet. An allergist can test for specific sensitivities, especially if fussiness is paired with rashes or vomiting. If symptoms persist, seek medical advice to ensure your baby's growth isn't affected. Ask yourself, is your baby calm after feeding, or fussy and distressed? Persistent crying is a red flag. Take steps to find the cause. If you're still reading and finding these insights valuable, please comment number 4 below to let me know you're here, and consider subscribing for more parenting tips. What to do if you notice these signs? If you've spotted any of these red flags, hives or rashes, vomiting or diarrhea, wheezing or breathing issues, or fussiness after feeding, it's time to take action to protect your child's health. Start by keeping a food diary, writing down everything your child eats and any symptoms that follow, including when they happen and how severe they are. This will help you and your doctor spot patterns, like reactions to milk, eggs, or nuts. Avoid giving suspected trigger foods until you get professional advice, as even small amounts can cause reactions. Consult your pediatrician as soon as possible, and ask for a referral to an allergist for specialized testing, like skin prick tests or blood tests, to confirm allergies. If symptoms are severe, like breathing problems or swelling, seek emergency care immediately and ask about carrying an epinephrine auto-injector for future safety. For babies, work closely with your doctor to adjust feeding plans, whether it's changing formula or modifying your diet if breastfeeding. Educate yourself and your child, if old enough, about avoiding allergens, and inform caregivers, teachers, or family members about your child's needs. Regular checkups with an allergist can help manage allergies and monitor your child's growth and health. Final thoughts. Now that you've learned these 4 red flags, take a moment to think about your child's health. Are they eating without issues, with clear skin, comfortable digestion, easy breathing, and calm feeding times? Or are you noticing signs like hives, vomiting, wheezing, or fussiness that could point to a food allergy? The good news is that food allergies, while serious, can be managed with the right steps, allowing your child to grow strong and stay safe. Your child's health in these early years sets the stage for their future, and catching allergies early can prevent complications, from poor growth to life-threatening reactions. Don't wait for symptoms to worsen. Start today. Keep a food diary, talk to your pediatrician, and explore testing if you see these red flags. These actions aren't just about solving problems now, they're about giving your child a healthy, happy start in life. Your child's well-being is your priority. Watch for these signs, act quickly, and keep them thriving. Comment number 28 below to share your thoughts or stay connected.